I don't know of hardly any runners out there that aren't worried about having to stop running from getting injured. But the good news is most of the time you don't actually have to stop running. But there are 4 injuries that I almost always make runners stop running with. They are 1, stress fractures, nerve pain, severe pain, and sometimes shin splints, depending on what the cause is. Keep watching because we're going to dive deeper into what these injuries mean, what they mean for you, and how to identify what they are. Hi there, I'm Dr. Abby Siler, a physical therapist and runner who specializes in helping runners stay injury free and get back on the road running without the drama of injuries. As runners, we just want to run. I get it. I hate not being able to run. And in my last video, I talked about how to know what pain is acceptable and what pain isn't acceptable and what you need to do to adjust your training plan if you're having pain. You can check it out here. However, there are, like I mentioned at the beginning, 4 times when those rules don't actually apply and we actually do have to stop runners from running. First, though, leave a comment below if you've ever gone into an appointment with a healthcare professional with some type of ache or pain, and the first thing before anything else is they tell you that you need to stop running until the pain goes away. I want to hear your story down in the comments. All right, so the first thing that you shouldn't push through when it comes to pain and injury and keep running through the pain, following the rules that I talked about in the last video, is nerve pain. Nerve pain can be presented as, so nerve injuries are, have you ever felt that numbness, tingling, electrical sensation that goes in, up and down your leg or down your arm? That's nerve pain. That is a type of pain that really we want to avoid, and we don't want to really try to run through it. First of all, it's hard to identify an acceptable level, kind of like I talked about in that last video, of pain or nerve pain that we can tolerate during a run without causing increased issues. Additionally, if nerve pain is ignored too long, it can cause some longer term effects and also make it harder to recover from in the long run if you keep irritating that nerve and causing those symptoms to happen. The key takeaway with nerve pain is if your pain is radiating, has that electrical numbness, tingling type sensation, better off to stop running for a bit, get professional help from a physical therapist, like you can with my one-on-one coaching, and put things on pause until we get a little bit deeper and figure out what's going on. The second thing that's probably the most common injury that causes runners to not be able to run and is the most critical one to stop running for are stress fractures. Stress fractures oftentimes present as what we think of as shin splints, but instead they're a sharp, localized pain in the area of a bone. Stress fractures are often accompanied by swelling and some, like I said, pinpoint localized pain, whereas shin splints, that's a little bit more diffuse type of pain. They typically happen when runners do that hangover effect or drunk effect, where you do too much, too soon, too fast for too long of a time, and the stress and the force of running and the compression that it puts on your bones is too much, and it causes what's called a stress reaction in the bone. And that's where stress fractures come from. There are differing levels of stress reactions that I'll get into in another video. So the reason that we need to stop running with stress fractures is the fact that if we keep causing that stress on it, even if we decrease our mileage down based off of those pain signals, like we talked about in the last video, is that it's still putting the damage is already done, and it's still putting the stress on that bone, and it's getting worse. It can eventually lead to a full-fledged fracture and require surgery in the long run. So remember, sharp stabbing pain that's really localized, definitely something that you need to get checked out by a professional and get evaluated on. Okay, so as I mentioned, the number 3 one is shin splints. Like I said, it's kind of sometimes a precursor to stress fractures. So it is also known as shin splints are known as medial tibial stress syndrome. Typically, there's a couple of different types, but that's the main type. It's common as well. It's, like I said, it's a precursor to stress fractures. So it's common because of that too fast, too soon type, too long type of mentality, type of training plan when you start running. So it's very common in new runners, or when those runners that decide to increase their race distance or increase their mileage too fast, too soon. So unlike stress fractures, because we aren't at the full stage of a stress reaction yet, shin splints don't require a full stop but they do require a dramatic decrease in your mileage because it's the precursor and what's probably going to lead to a shin stress fracture a lot of times. So typically, I recommend a 50% cut in mileage overall on a week-by-week basis. So while not a complete stop in running, it can be a pretty dramatic stop and feel like you're not doing anything at all. But this is to mention, important to mention, is that even though these injuries require you to not run anymore, the rest is not rehab. Rest is not going to fix the issue. You're going to have to put in the work with a physical therapist or other rehab professional one-on-one and work on getting back to where you want to be and preventing these injuries and healing these injuries. The fourth injury or common pain that you should not run on goes back to last week's video, and that is severe pain. This is that sharp shooting pain that accompanies something going on, something wrong. So if you are running and you have a sharp pain that stops you in your tracks or makes your gait change, your running ability change, you need to stop running until you can get further evaluated. That's a sign that you are doing something that is not beneficial and you need to take a step back and look at things. Typically, this type of severe pain, it's not going to be a long stop from running, such as like stress fractures require you to be away from running for a long time. But rule of thumb, if it's a sharp pain that's sharp enough to make you stop, it means that you need to go see a physical therapist and get evaluated more. One more injury that I didn't mention or that I didn't list that didn't make it to these top 4, but it's still important to mention is Achilles tendinopathy. I typically don't stop runners from running with any type of tendinopathy because we have to build up the tissue, we have to build up the tendons to be able to tolerate what running is. And if we full stop on that, then it just leads to more problems. However, in my experience, Achilles tendinopathy tends to be a little bit more sensitive to running, and it's something that we will have to scale quite a bit, and we might have to take a week or 2 off from running in order to be able to start the rehab and let things calm down a little bit. So overall, the biggest takeaway that I want you to get from this video is that not all injuries are devastating, cause you to stop running. They can be a pain, literally and figuratively, to deal with. Not all pain, though, is created equally. So keep that in mind and pay attention to what you're feeling. If you're in doubt and you have that feeling that something's not right, it's better to seek help and figure out what's going on than continuing to run on something and leading to a bigger issue that's going to make you stop running. Early treatment is always better, and it's much faster to deal with an injury if you do something earlier. So if you're unsure or need something, schedule a one-on-one call with me. I can help you out and get you evaluated and keep you running before your injury becomes an issue. I've linked in the description how to apply for my one-on-one coaching and also any of the programs that I have as well. Okay, so in the next video, though, we're going to talk about the top 5 myths about recovering from an injury and what you should and shouldn't do, and things that you absolutely need to ignore that are just myths floating around out there. See you next week.